Picture yourself at a TEDx event, a large event, and let's, for simplicity, take 1,000 people. So here we are, and that's great. And let's now come back, because everybody's healthy. Let's come back 20 years from now. Same place. Isn't that great? Well, it's not that great, because 20 years from now, there's going to be 30 people with heart failure. And 20 years from now, roughly 56 of us will have had stroke. And the numbers get worse. 20 years from now, 120 people have developed type 2 diabetes, and 450 of us have by then a cardiovascular disorder, or multiple. And the last figure is the highest number. 900 of us have developed presbyopia. And while that may sound the scariest, it's actually the only non-life-threatening illness. It just means that 20 years from now, we all need reading glasses. What does this mean? This means that 20 years from now, there's only a few healthy seats left. So now is the time to change seats. Unfortunately, they're not labeled. And why are there only a few healthy seats left? Well, the impact of our lifestyle choices is not seen tomorrow, the day after tomorrow. It's seen 10, 20, 30 years from now, because our behavior plays such a big role in our health. More than half of what determines our health is our behavior. And furthermore, I'm sad to say, medicine is to blame for this, because medicine has saved tremendous amount of lives and has increased life expectancy. And when looking at the last century, we've gotten older and older and older. And as a consequence, chronic diseases have emerged and have started dominating. And if this trend really persists, by 2060, we will be spending maybe half of our life being sick. So we look forward to a long, sick life. Now, I understand none of us is really looking forward to a long, sick life. But on the other hand, nobody here is surprised when they see a picture of an elderly gentleman in a hospital bed. We all say, oh yes, this is what we can expect. But it doesn't have to be that way. And we think we can do better. And prevention is one of the keys to a solution that has not been sufficiently used and unlocked. And looking again at the last century, just like after the war, after the Second World War, vaccination and inoculation has saved a large amount of lives. A lifelong focus on prevention through behavior change is going to curb that appearance of chronic illnesses, and we're going to get older being healthy, so we can look forward finally to a long and healthy life. And that older gentleman in a hospital bed, we can find him then on a longboard instead. Now, I, for one, am definitely looking forward to that future. And technology, I think, can play a big role. It's not a magic bullet, but it can provide tools for both the care cycle, the cure, and for the prevention. And to show that, I have a number of examples. And I looked at a colleague of ours, LARS, and I'm fast-forwarding through his whole life in 15 seconds. This was LARS. He's growing up. This is about now. This is Lars today. And now he's getting older. So now it's 2060. He's 82 years old. That in itself is nice. The problem is he has developed heart failure. And he's not alone. 30 in 1,000 people, 6 in this audience will develop heart failure. And the worst part is it's a very complex condition where the heart is no longer able to pump sufficient blood to serve all the needs of the body. And one of the many consequences is that you have a congestion and fluid buildup in the lungs, making respiration increasingly difficult, particularly when lying down. And there is no cure. The situation just worsens, and there are repeated hospital admissions. And the only way to monitor that congestion is by thorax X-ray, and then it's followed by putting in a drain to drain the fluid. And it would be great if we could reduce or prevent these hospital readmissions, if we could pick them up earlier, and if we could see that fluid build up. Because if we were able to monitor that at home on LARS, we could prevent or at the very least reduce hospital readmissions, and we could change the therapy or readjust the therapy so that the efficiency would increase. And to do that, or to attempt that, we created a wearable patch, health patch prototype. It's a demonstrator, it's an early model, and it can monitor a lot of parameters, and among them the bioimpedance, which we hoped would show fluid buildup. And we tried it on a number of patients with congestive heart failure, and here we see a patient whose situation is worsening, and there is an increasing fluid buildup, as shown by thorax X-ray, and at the same time we see a corresponding decrease of the electrical sensor signal. And similarly, when the patient receives a drain and the fluid is reducing, we see that in thorax X-ray, but even better, we can pick that up also on the sensor, on the wearable sensor signal. And even more so, when the patient is recovering, we see his respiration rates slow down, we see the volume increase again because there's less fluid, and we also see his heart rate normalize. So this would really be great if LARS could use this at home, and he could be followed up and therefore have less readmissions or a better therapy for him. But let's go back in time. Let's go back maybe when he was in his 50s, maybe we can slow down or prevent that condition. So Lars is 52 years old, and he started to develop some asymptomatic conditions, such as hypertension or sleep apnea. Now, sleep apnea is a respiratory condition where you have upper airway collapse, so making it impossible to breathe for a period of time when sleeping. And this is certainly annoying for Lars's partner because he will be snoring a lot. But it also puts a tremendous strain on Lars's body, and it is one of the reasons for increased risk of cardiovascular disorders later on. Now, today, diagnosing sleep apnea is done in a sleep clinic with a polysomnograph, and that looks like this. Now, one thing is sure, you're not going to sleep all that well when you're wired up like this. So for that reason, we were thinking, can we create a more convenient device that can either do triage at home, prescribed by GP, or even diagnose sleep apnea and provide an index in a far more convenient setting. And for that, we created, again, a small, tiny module that could be worn by Lars. And we did some trials on a number of people, and when nothing is wrong, we can see respiration rate and respiration volume, and we did a side-by-side test with that clinical polysomnograph. But also we tested it on patients with sleep apnea. And as you can see, we were able to see these periods when the respiration was halted, and we're currently exploring this on a larger patient population to be sure that the sensitivity and the specificity is high enough. But this is very promising for Lars, and particularly for making it very convenient for him rather than having to go to a sleep clinic. Another point is we are creating a health patch. We are creating that device as a semi-disposable. So there's a disposable skin adhesive, and there's a tiny electronic block that can be reduced, barely the size of a small memory stick. So convenience for Lars is very important. Another risk factor that he was faced with is hypertension, and today that is done with a cuff. And together with partners, we are looking at cuffless blood pressure monitoring, and that's still a big challenge. And today we don't have a perfect solution, but we do have a proxy for blood pressure by measuring pulse arrival time based on ECG and photoplethysmography using a wearable. So we get an indicator for blood pressure, which particularly for following up patients like Lars is a lot more convenient than having that inflatable cuff. So we think all in all that based on these two examples, wearable technology can help all of us to manage the chronic conditions and maybe even detect and prevent those risks. Now let's go further back in time. When Lars was 45 years old, you could see him around 2035 squinting at that magazine. And he also had a headache because he was developing presbyopia, near age-related nearsightedness, so he needed reading glasses. And they are not that fantastic. They're not that great. You have sort of a limited field of view. And we are thinking, can we create a smart contact lens that takes over, that adjusts the focus when needed? So just like a regular contact lens, and if you're looking far, it focuses differently than when you're looking close, so it is taking over the role of the deficient intraocular lens. And for that, we created a concept that we call a smart tunable contact lens that has the electro-optic component, has the autofocusing, so lots of electronics and sensorics are needed inside, in a tiny form factor, in a curved and flexible form factor, and we started creating some of the building blocks. And here is one of them. Here you see an electrically tunable lens, and the upper part where you see the E getting into focus and out of focus, that's done electronically. That's the size and the shape of a contact lens. So this is promising. Now on the other hand, you also see that there's a cable going to the electronics. So nobody in his right mind would wear this at the moment because the electronics is not yet inside, and that's what we're working on. But we are convinced that it will not take until 2035 before we have a solution. We're also looking at the embedding of the electronic contact lens in a hydrogel, very important for the comfort of the patient. And when doing so, we think that by 2035, Lars will not be looking like this. He will be happily reading a magazine with this smart contact lens. Now, if we go further back in time, Lars today, 30 years old. You already saw that he was looking at this chocolate ganache and macaroons. So as a result, he actually doesn't look like this. He looks chubby, and he's not alone. He's not the only one, as we all know, and his lifestyle is to blame. And how can we change and help him change his habits? It's very different. It's hardwired in the brain, bad habits as well as good habits. But 100 years of psychology have taught us that if you have a clear goal, if you're self-aware, if you have strong motivation, and if you repeat an exercise, continuity of training, it works. Today, the only successful approach is a personal coach, because he or she learns your habits and so on. Now, unfortunately, not all of us can have our own personal coach. So what we're working towards is, can we create a personal virtual coach that has looks at all these aspects? And what's really important, if we think that wearable technology can help, what's really important is that it's very convenient. And today's wearables are not convenient. And you see here the young woman running with a textile integrated health patch. So it's imperceptible, it monitors all these parameters, and when looking at the shirt, you have the sensor inside, zooming in a bit more. Here it's in a different color. Printed sensors, printed electrodes, looking at respiration rate and volume, looking at heart rate variability. It feels just like any other t-shirt, but nobody notices. You don't have to remember to turn on your smartwatch. So you have a lot more convenience for the user. And when using this system, you have even more opportunities. If you start adding electronics, you can even add other devices, like you see Sulky here, wearing a more fashionable smart jacket with light-emitting diodes, because it can serve both a sensoric function as well as an aesthetic function. And when using such a jacket or shirt, we can learn Sulky or Lars's habits. We can find out whether he or she is a morning person or an evening person and tune the coaching accordingly, because we're all different. We don't benefit from a regular trajectory, a straight line trajectory from where we are today to our goal. In fact, for everybody, it's a different trajectory. It will be a long and winding road. And at many moments, Lars here will be tempted to go back to his old behavior. And we have to pick that up with wearable and contextual sensors so that exactly at those moments we can give Lars the necessary nudge to steer him in the right behavior. And that way, we will be able to create a virtual coach that is just as appealing as this personal trainer, this personal coach. And Lars had another problem, and that was he was under stress. And stress can be monitored, fortunately, as well, using a number of parameters. Heart rate variability, skin temperature, sweating. So wearables can play a role and maybe affect him and help him not getting burnout or depression. And so we started measuring Lars, and we saw many signals, and zooming in, we could really see that his heart rate was changing and his perspiration was changing. Now what turns out is that for one person, his perspiration may be a good indicator of his stress. And for other people, it may actually be his heart rate variability. So what we need here is not a static app. We need a truly personalized app with artificial intelligence that is adapting itself to the user's need, and that way we will get a truly personalized stress indicator, and we probably are going to be able to keep Lars from getting burnout or depression, we hope. And for that we are working together with behavioral scientists and psychologists to cover that coaching trajectory. Last example, before Lars was born, even Lars's mom, Karen, would have liked to have a wearable that was looking at Lars's kicking and at the contractions, and thereby give a comprehensive view of the health of the mother, of the health of the baby. And we think that such a device is also going to create a large data set that will pave the way for evidence-based clinical algorithms that hopefully predict and manage pregnancy complications like preeclampsia and gestational diabetes and so on. So even little Lars can benefit probably from wearables. To end, a small poem. Health problems. I don't have a personal coach. The doctor determines my health. My behavior does not matter. The past repeats itself. That is the past, and that is depressing. But together we can turn it upside down, and upside down it reads totally different. It reads, the past does not matter. My behavior determines my health. The doctor is a personal coach, and I don't have health problems. That's what we work for. Thank you.